But what do they mean and where do they originate from? Surprisingly, celiac disease has its origins set all the way back to the 1st and 2nd century AD. Greek physician Aridas of Cappadocia reported the first incidence of celiac disease and phrased it coliacos, from the Greek word kolia, meaning abdomen. It wasn't until 1888 when an English pediatrician, Dr. Samuel Gee, first gave an accurate description of celiac disease. Dr. Gee described celiac disease as a kind of chronic indigestion which is met with in persons of all ages. And he noted the regulation of food was important, therefore suggesting that dietary intolerances may be the source of the disease. Furthermore, Dr. Gee hypothesized that if a patient can be cured at all, it must be by means of diet. Following this discovery, in 1950, Wim Dick illustrated that the removal of wheat, rye, and oats had profound improvements on symptoms. It was later noted that gluten, a protein component of wheat, was the toxic substance. Today, celiac disease is the most prevalent food intolerance in the Western world, and it affects 1% of the global population. Considering that there are over 200 associated celiac disease symptoms, diagnosis can prove to be challenging. Furthermore, symptom manifestation differs from person to person, and some people do not elicit any symptoms at all. Common symptoms in children include, but are not limited to, abdominal bloating and pain, chronic diarrhea, weight loss, and vomiting. Interestingly, studies show that adults are less likely to have digestive symptoms and are more prone to display symptoms such as fatigue, unexplained iron deficiency, arthritis, and osteoporosis. Celiac disease is a complex disease because there are several factors involved. Essentially, it is an autoimmune disorder, meaning that the body attacks its own cells, tissues, and organs. Aside from gluten intolerance and exposure, there are other factors that cause celiac disease, such as genetic predisposition and abnormal small intestine composition. Gluten sensitivity is frequently misdiagnosed as celiac disease. In both cases, foods containing gluten produce gastrointestinal symptoms such as anemia, diarrhea, weight loss, and potential growth failure. However, in gluten-sensitive individuals, there is a very small autoimmune response, yet symptoms similar to celiac disease persist. Unfortunately, not enough research has been conducted in the field to allow for a specific method of diagnosing gluten sensitivity. Instead, doctors must first rule out celiac disease and other related conditions like wheat allergies. You might ask, how is celiac disease diagnosed? Well, doctors must run antibody testing to see if specific antibodies such as anti-tissue transglutaminase is present in the blood. These antibodies are used by the elevated immune response in patients with celiac disease. When these antibodies are present in the blood, doctors recommend a small intestine biopsy, which is considered positive when the small intestinal cells are revealed to be damaged. Sometimes doctors also use DNA testing to see if the patient has the genetic component which predisposes individuals to celiac disease. So great, we know how to diagnose it, but how do we treat it? The best and only method of treating celiac disease is to abstain from gluten-containing foods. When gluten is no longer ingested, individuals show significant improvement and eventual relief from symptoms. However, this is not a cure, and it is only an effective control strategy. The term gluten actually refers to a large family which includes hundreds of proteins that are found in wheat and other grain products. The two most common classes of proteins are gliadins and glutenins. If you think of bread, gluten gives the bread dough its elasticity, and gliadins are the proteins that give it the ability to rise when baked. The three common categories that people may refer to when talking about gluten are wheat, barley, and rye. Wheat, as many of you may know, is found in things like bread, pasta, and cereals. Unknown to many people, barley is commonly found in food coloring, beer, and malt products such as malt extract and malt vinegar. Rye is commonly found in rye bread, rye beer, and cereals. Even though it sounds like this eliminates a lot of common food items, there are many things to swap into a diet that are gluten-free. Foods such as flax, nut flours, quinoa, certain types of rice, and soy are all gluten-free. In order to be labeled as gluten-free, the product must have less than 20 parts per million of gluten. When you consume food, it eventually ends up in the small intestine before being absorbed into the body. The small intestine is lined with cells called enterocytes, which have finger-like projections called villi. and these villi contain enzymes which help to break down food. Once the food is broken down, the nutrients are able to pass through the intestinal wall and into the bloodstream, where they can then travel throughout the body. When someone with celiac disease consumes gluten, there is an immune response at the level of the small intestine. Gluten fragments cross through the intestinal lining and evoke a cascade of events that lead to the production of killer T cells, which directly attack the enterocytes. As well, B cells release antibodies which can cause even more damage to the enterocytes. Ultimately, the immune response leads to the damage of the enterocytes and villi. This does not allow for proper absorption of nutrients into the bloodstream. So how does a gluten-free diet affect people who don't have celiac disease? Like any diet, a gluten-free diet has its benefits and risks. In a study by researchers that evaluated the nutritional content of gluten-free and gluten-containing food products, gluten-free foods consistently showed lower average protein content, but no nutritional differences were found in total calories, fiber, fats, sugar, or sodium content. Even though there are very little differences between gluten-free and gluten-containing foods, many people believe a gluten-free diet results in weight loss. However, current research suggests that gluten-free diets may actually result in nutrient deficiencies in some individuals. It is found that oftentimes when people go on a gluten-free diet, they avoid carbohydrate-rich food, which may result in weight loss. However, women on the gluten-free diet also end up consuming significantly lower amounts of fiber, folate, iron, and calcium, and significantly more fat and cholesterol, while men consume much higher amounts of fat and sodium. The decrease in carbohydrate intake among these dieters, although beneficial for weight loss, may actually put them at an increased risk for coronary artery disease. The avoidance of gluten is found to lead to a reduction in the consumption of beneficial whole grains. In a society where gluten-free diets are on the rise, it is important that misconceptions and facts are addressed. You have to understand that gluten is not the enemy. There is really no benefit or harm to consuming gluten itself unless you have celiac disease. Like any diet, a gluten-free diet has its positives and negatives. It is ultimately up to the consumer on how they want to execute the diet to keep themselves healthy and happy.